Hey, Adni fam, I'm so excited to be joined by Brittany Williamson today, who is the Director of Nursing at ShiftMed. And I think Brittany just brings such a wealth of knowledge of the nursing world, but also now different technologies that can support healthcare workers, really at the bedside and beyond throughout our career. So thank you, Brittany, so much for joining us on the Adni podcast. Really, really excited to dive into your story and learn more about ShiftMed.
Thanks, Anthony. I am just super excited to be here. Thank you for asking me. It's an honor.
Yeah, no, it's so amazing. And I mean, as soon as I discovered your role and kind of your journey into ShiftMed, I was so excited because I love seeing nurses at, companies serving healthcare workers. I think it's so awesome that ShiftMed has you as a leader that can really help kind of, direct the company to best serve, clinicians. So would love to learn how you got started into ShiftMed, like a little bit more about your background, what type of nurse you were. Really, if you could just kind of run us through your journey to how you got where you are.
Sure. Well, I started in the healthcare field initially as a social worker. And I worked in the downtown Indianapolis area doing community-based mental health social work, which was quite a wild ride, and really started to get very involved in my patients' medical care in addition to their mental health care.
Yeah.
And I don't know, what different types of larger cities you worked in as a bedside nurse, but I think that, we just really started to see how complex these cases were for our patients. And so that really springboarded my journey into the nursing world. So I went back to school for my second healthcare career and became an RN and started out as a bedside nurse in one of our Trauma One facilities in Indianapolis, and really just got to experience the full gamut of any and everything you can imagine. I worked nights, and I think you did too. Yes.
Yes, we love night shift.
Yes. So it's wild, right? You have to learn so quickly, and you're really not completely on your own, but you're really on your own there at night with your patients. And really just started to get very interested in, supporting patients in a different way, trying to figure out what other options were out there as well. I so loved working in the mental health field because I got to really experience people in a variety of different places. And so it really kind of fast forwarding a little bit through my nursing career, worked in a couple of different care settings, worked for some outpatient practices as well as in the post-acute care world as well. But then really what brought me to ShiftMed, it was January of 2022. I'm like, where are we in time right now?
Time flies by. Yeah.
Yes. And my dad became a patient in the hospital after a really severe accident.
Mm.
And he was a trauma to one of our trauma hospitals in Indianapolis. And this was during one of the COVID surges that we had. And I remember thinking, like, leading up to this week ahead of time and talking to somebody that week ahead of time, as long as nobody gets sick, or as long as nobody in my family ends up in the hospital over the next couple weeks, everything's going to be fine. We'll get through this surge. And then all of a sudden, bam, my dad ends up in the hospital. We are in the midst of a COVID surge. He is a trauma. And I always think that perspective of nursing, it's you have a completely different perspective when you are the nurse and you're taking care of your patients and you're
Yeah.
advocating for them and you're, doing for them and you're working with their family. But as soon as you become the family member of someone who needs life-saving care, that really knocked me off my feet. I
Yeah.
mean, it was It was a very humbling experience. And we spent about a month in the hospital. And really, I kind of got to zoom out on the experience of nurses. And I was looking at it from the perspective of somebody from the outside, but with that nursing lens still, right? Um, and really just started to notice just the burden and the effects, the emotional toll that nursing was having on our healthcare professionals, and and just the impact of COVID over, going into, another full year of really just experiencing these extreme states in our hospital systems just being stretched to their fullest. And just really was reflecting quite a bit on, just the experience of those nurses that were taking care of my dad, and wondering really, how were they truly feeling, and what was what had their experience been like. um and I just felt like I needed to find somewhere that I could do more for our nurses um that are working at the bedside. And that's really what led me to ShiftMed. I then started in April of that year. So
Wow.
it was just that was kind of a transitional moment for me, as a nurse, but also as a family member, and as just someone observing the healthcare system really in true crisis.
Well, thank you so much for sharing that story. I think you're so right. Like when you see kind of healthcare from those different perspectives, of course we've seen it as bedside nurses, but then I think when you see it on the other side, it really is so eye-opening. And I really appreciate you sharing your story in terms of how that kind of inspired you to want to do more and want to kind of help build technologies that can support clinicians in unique ways. So for listeners that maybe aren't as familiar with ShiftMed, would love for you to just share, what is ShiftMed? What exactly does your product do? And what exactly is your role there?
Yeah, absolutely. So, ShiftMed is a workforce platform that allows nurses to work when and where they want. And what ShiftMed does is we combine our workforce technology with our workforce marketplace of healthcare professionals to connect our healthcare facilities with our healthcare professionals. So we really have about 2,000 healthcare facilities across the United States that we are currently engaged with, and have a network of over 350,000 healthcare professionals that we are able to connect our healthcare facilities with. And truly, like I said, it is allowing our nurses to work when and where they want. So it is a workforce platform that starts with an experience by downloading an app. So you would go to the App Store and download the ShiftMed app. And we have made it to where it's a very seamless process to get credentialed and then see what options are in your area. The app fully walks you through the whole credentialing process, the onboarding process, and then assists our nurses in finding either supplemental work or full-time work in their area. I think one of the really great things that ShiftMed provides nurses is the ability to either choose to work full-time but in a per diem manner, or to work just supplemental. It's a really great platform for those healthcare professionals who are going back to school and they need to flex their schedule, or for those healthcare professionals that are doing some more moving around. Maybe their life circumstances are taking them to different facilities or different areas, and it can instantly connect them with facilities that have a need for them to come work at their place of employment. I think one of the really important things that I think is just at the heart of what I do as the director of nursing at ShiftMed is really working to make that process of connecting our healthcare professionals with our healthcare facilities less transactional, and more of a partnership. So not only we want our healthcare facilities that we work with to feel like we are a strategic partner for them to help manage their labor, and to help provide them with the necessary resources they need to staff their hospital and to provide the best care for patients. But I really also want it to be a place where our nurses feel like they can come and work and they have a support team. I think one of the challenges, and I don't know if you ever experienced this as a nurse, um, is just that feeling of like kind of being out there on your own and sort of without maybe some support or guidance. And I think that can particularly present itself if you are working somewhere full time or you don't have a home base. And so,
Right.
my goal really here at ShiftMed as the director of nursing is to make our healthcare professionals, the nurses that work on our platform, feel like that through myself and the team that I support, that our nurses do have that support team that exists. It's just not in the traditional manner that they might be used to in previous employment.
I absolutely love it. It's such a genius platform. Like, I mean, there's so many use cases I can think of where, a clinician just wants that flexibility. And there's probably so many clinicians out there that, maybe just aren't working because they feel like they don't have time or they don't want to take on a full, permanent position because as you mentioned, they're back in school, they're traveling, they're moving, they're dealing with life, etc. So it's so exciting that there's this new way for clinicians to, be able to work when and where they want. And I'm curious, kind of in your role, as a nurse, but also now as, a leader at this technology company, how have you seen this flexibility make an impact for nurses, but also for, the healthcare facilities that ShiftMed works with?
Yeah, absolutely. It's a great question. I think one of the things that we're trying to solve for not only ShiftMed, but other organizations like Adni, is how can we best support the nurses out there? And it's not a one size fits all. There is no one company that can provide all of the solutions to help keep nurses at the bedside and help them feel supported. But really, that goal of maintaining a work life balance. And so, one of the things I think that's important for nurses is that flexible scheduling, as you mentioned, the ability to pick up shifts. Maybe one week they can work 5 shifts, but the next week they can't work any because something else is happening in their life and they need to create that alternative schedule for themselves. But we also know that there are all of these other things that nurses need support with, right? They need mental health support. They need, peer support. They need professional development support. They need, the support of technology to provide them with these different tools. And ShiftMed has really taken a really, I think, hard look at what exactly we can do as an organization to support our healthcare professionals. And we know that one of the barriers, I think, for a lot of our healthcare professionals, particularly in more urban areas, is transportation. Transportation can be a huge barrier to getting our healthcare professionals to and from work. And so we have a partnership with Uber Health that allows for our healthcare professionals to not only book their shift within the ShiftMed app, but then also at the same time schedule their ride through Uber Health. So they know that they don't have to worry about that. When they get up on Tuesday morning to go to work, their ride is coming, and that's one thing that can be taken off of their plate for them. That's one thing that they don't have to worry about, trying to find a ride or, navigating the transportation system in a large city. And so I think that that has been a really wonderful way that we have seen our platform really create this full service type of experience for not only the healthcare professional, but also our facilities, because then they know and can see
Yeah,
this healthcare professional is on the way. We don't have to know, we don't have to worry about them not coming or somebody not being able to show up. And that
very
partnership
true.
has really driven the fulfillment of our shifts and really helped our facility partners ensure that they have the right number of staff to take care of the patients in their facility.
This is just amazing. This is why I love like technology and nursing because it's like you might not even have thought of, hey, like how smart would it be to make sure that our clinicians can get transportation to their shift and like, you know, how big of an impact that could make for not only the clinician but also for the facility that ShiftMed's working with. So that is so, I think, such a great example of, I think, ways that technology can support clinicians and that support for the clinician really also impacting the healthcare organization, right? And I think that really is kind of meeting the needs of all the stakeholders, which is so exciting. So, on that note, kind of innovative partnerships and things that ShiftMed is doing that I feel are so unique to clinicians. I'm curious how your background as a bedside nurse has really kind of helped inform your strategy and decision making at ShiftMed in this role as director of nursing. Like, how do you feel like your background, like as a nurse, has come into play in your role at ShiftMed?
Yeah, absolutely. That's a great question. And it's something I think sometimes that we maybe discount ourselves a little bit as clinicians at heart. Like,
Yeah,
what 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 are we providing to these conversations? And it really is significant. I'm thinking about we have launched some very big partnerships with health systems across the country over the last year, and preparing for staffing these not only just hospitals but health systems as a whole has been a really, really exciting process. And I think for me as a nurse, I have really been able to get in there and help our teams and our product teams and our developers understand the credentials that are required and what that means, and how can we best make sure that our clinicians have the exact right credentials, and if they don't, how can we best lead them to where they can get that credential? How can we help them easily identify what they need and then where to go to get it if they're wanting to work a particular type of shift? I think my understanding of larger health systems as a whole has helped with also figuring out how do we provide our clinicians with the tools to succeed once they get to their shift or once they arrive to that health system for the first time. If you think about a first day of work, it's nerve wracking, right? It's overwhelming. Maybe you haven't been to this particular facility before, or even if you have, you haven't been there as a nurse. And so, how can I, as our director of nursing, help our healthcare professionals have all the tools that they need to be successful the moment they walk in the door? So, meaning they know exactly what color of scrubs to wear, they know exactly where they're going to get their badge, they know where to go for their orientation, and then they know exactly what type of units are available at the healthcare facility. And then we can help them determine, based upon their experience, which units they're able to work on, and then really help develop that partnership with the facility throughout that process. And I think one of the great things that my team is able to do um, is really engage with our health systems as clinicians. I think
yeah,
that clinician to clinician conversation is so impactful. In talking to other nursing leaders at health systems across the country, I think being able to have just that nurse to nurse conversation in our own type of language that we like to speak to one another in can really help create a more positive experience, not only for the health system, but then also our healthcare professionals that work for ShiftMed, and then translating that into the technology that exists on our platform and making it to where, again, like I said, we have a seamless process for our healthcare professionals so they don't experience those pain points that you might have of applying for jobs or onboarding at a new company. We really take all of those things into consideration and make sure that all of that is set up for them and that they have everything that they need ahead of time so they feel prepared and they can go in confident and they can then cultivate that relationship with the healthcare facility and their patients at the bedside. I think, I used to, as a nurse, I had a fairly long drive in to the hospital that I worked at, and I had to park in a parking garage, and then I had a long walk into the hospital. So I usually, when I would pull into that parking garage, I would just sit there for a couple of minutes, and I usually picked like one song to listen to before I went into my shift to really get in the right headspace, because
Yeah.
when you're going into work a 12+ hour shift, you have to be fully present, and you have to be fully present for every minute that you're there. And so I think when we as an organization can take away some of those other stressors that exist with getting people to work and knowing where they need to be and what they need to do, again, that really helps our clinicians at the bedside be successful.
That's so amazing and so, so incredible that you can bring those perspectives to your team and be an advocate for the clinicians and the clinician perspective. I think it's so, so wonderful. And again, I get so excited every time I see nurses and clinicians like working in tech and, really being a voice to shape these technologies that can make such a big impact. So I think some of the kind of comments you were making lends itself really well to the next question, which is, for clinicians that are listening to this podcast episode and maybe they've wanted to work per diem or maybe they've wanted to pick up a shift or maybe this idea of flexibility and working when and where you want sounds really compelling to them, but, maybe they're feeling a little scared, maybe they, just have some hesitations. Would just love to hear from your, perspective as both a nurse and also, a leader at ShiftMed. What would basically be some of your advice for, a clinician that maybe is excited and wants to try out ShiftMed, but has like a few like hesitations or fears?
Sure. And I think that's a super valid point because I think, um, historically, particularly in healthcare, we always seem to be a little bit behind the game when it comes to technology in this field. And so I
Yeah,
think, historically speaking, that technology has been sort of the enemy. And I
yeah,
really want to work to shift that perspective and change that perception. I think, one of the best parts of working a per diem type of job is the ability to, again, work when you want and where you want. But with that, maybe the hesitations are, what if I get called off for my shift? Then, how am I going to get paid? One of the awesome things that ShiftMed does is we utilize a feature called guaranteed shifts, and we utilize that at many of our facility partners, where when you pick up a shift that's a guaranteed shift, even if the facility has to cancel your shift for whatever reason, you still get paid for that shift. So if there's that fear that I'm transitioning my employment to something alternative and maybe I won't have the ability to use PTO to supplement my paycheck
right.
if I don't, if I get called off on a shift. That I think is a really reassuring factor for our clinicians who might have that at the forefront of their mind when they're considering it kind of an alternative type of employment. And I think also that shows really the commitment of the healthcare facility to our healthcare professionals that, hey, we do want you and we need you. And so by putting this designation with our shift, just know that we do want and need you at the shift. And if for some reason you're not going to be, we don't want you to have any kind of negative consequences to your own circumstances because of it.
Yeah,
Um, I also think I think the one of the really great things about ShiftMed, and for me as a nurse, I think one of the most important things for me is serving the community in where working and serving the community where I live. And historically, I think there hasn't been as many options for nurses looking for alternative types of scheduling or alternative types of shifts to work. There hasn't necessarily been that opportunity to stay engaged in their own community. And ShiftMed really does allow that for our healthcare professionals. It allows you to still make an impact and engage in a meaningful way within the community where you live, and you can serve in that way. But then also it allows you to have the flexibility to go elsewhere when, again, life takes you in another direction. And I think that those things could be just so attractive to healthcare professionals out there really trained to search for, how do I create the best work-life balance for myself? I think, we know in order for our nurses to stay engaged and to stay working at the bedside, we really have to strive to achieve that work-life balance. And so utilizing a tool like ShiftMed to support your mental health in that sort of way, to support your life in that sort of way, can be so meaningful.
I think that's so well said. And also, these transitions are perfect. It lends itself so well into kind of the last kind of wrap up question of the podcast episode. I think you've mentioned so many wonderful things about, clinician well-being, about how, ShiftMed and companies can, serve clinicians, in a holistic fashion, just like we do as nurses for our patients, right? Like thinking about the patient in a holistic way, not just offering jobs, but also offering, support and transportation and these things that, you might not have even thought about, but can go a really long way. And one of the things at Adni that we're really passionate about is just how we can rehumanize healthcare staffing. I think as clinicians, it's so easy to feel like sometimes you're a cog in the machine, or, you're kind of not always viewed in that holistic, supportive way. So I'm kind of curious from your perspective, having worked as a bedside nurse, having now worked at a technology company, serving clinicians in this really special way to bring work-life balance, back to our profession. Would love to know why you think that rehumanizing healthcare staffing is more important maybe now than ever before.
Absolutely. Oh my gosh. Yes. What a great question. I mean, just everything about what you said, why it's so important at this time. I think we're really at a pivotal, pivotal point in healthcare,
Yeah.
um, right now, with different legislation happening, and just really some alarming statistics about the number of nurses leaving the bedside. The rate of nurses leaving the bedside is extremely high. And I think, my perspective, again, like I shared at the beginning, when you asked kind of what led me here, is you just never know when either yourself or someone that you love so very much is going to need the care of a nurse, and a nurse who is happy and healthy and rested to the best of their abilities that day. It is so important. And so I just think, gosh, for me, and even though I don't work at the bedside anymore, nursing is a 24/7 commitment for me. Everything that I do and talk about and consume has that healthcare and, um, giving and caring and nurturing perspective. And so, that for our nurses, especially those nurses that are at the bedside, those long hours and the high emotional uh, demand that takes, can really, really cause some serious stress and burnout. And so I just think that, again, like I said, there's no one solution. There are so many solutions required to help support our healthcare professionals. And so I think everything that we can do, not only at ShiftMed and also at Adni and all of these other organizations that exist to support our nurses, is so important, because when someone that you love needs care, you want the very best for them, and you want to have a nurse there that can do that. And so I think that's, just, it's very important to me. And I think anything that we can do to help further drive the needle in the right direction as far as clinician well-being, particularly, is huge.
100%. I couldn't agree more. And yeah, I think just remembering, clinicians are humans. We have emotions and we have life that's going on, that we have to, often deal with while we're also working clinically, while we're picking up shifts. And I think it's so, so exciting that ShiftMed is this tool that we can leverage to, build a schedule that works best for us and have that work-life balance and access, really just a fulfilling career, which I think is so special. So congratulations on everything you've accomplished. Congrats on just this role and bringing the nursing perspective into technology and everything you're building at ShiftMed. It's so inspiring. And I know that all the clinicians and healthcare staffing leaders listening to this are just going to feel so excited and inspired for the future. And I think it'll be really, really exciting to see kind of this next chapter of, how we can continue to just make things better for clinicians and healthcare as a whole.
Absolutely. Thank you so much. I just so appreciate your enthusiasm and passion for healthcare and all that, our clinicians do. And I absolutely love it. This has been amazing. I feel like I could talk forever with you.
No, we literally could probably talk about this topic for another 6 hours and still have more to say. But yes, everyone definitely go check out ShiftMed. You can download the app and pick up a shift in your area. And Brittany, thank you so much for doing the podcast. I really appreciate it.
Thank you, Anthony, so much. Really appreciate it. And I hope you have a wonderful holiday.
Thanks for listening, everyone.